President Obama is turning to some of the biggest names in tech to assess the problems and progress already made at the healthcare.gov website. Among the bold-faced names heading to the White House tomorrow, Apple CEO Tim Cook, Marissa Mayer of Yahoo, Twitter CEO Dick Costolo, Sheryl Sandberg of Facebook, and Google Executive Chairman Eric Schmidt.
Meantime, Americans have one more week to sign up for a new health insurance plan on those online exchanges. One more week, that is, if you want coverage to start January 1st. And new numbers from federal and state authorities now point to a big surge in new members as we approach that deadline. Bertha Coombs has more.
From day one of open enrollment, New York's exchange has seen strong interest in Affordable Care Act plans, with more than 45,000 enrollments in the first 2 months. But in the first 2 weeks of December, enrollment through New York State of Health has already more than doubled, with roughly 3,300 people a day signing up for coverage. That's well ahead of projections. Covered California has been signing up residents at a pace of 7,100 a day this month, reporting more than 156,000 plan selections through the first week of December. That's 46% higher than its combined total for October and November. Kentucky, the only southern state operating its own exchange, saw its plan selection numbers last week jump 35% from its totals for the first 2 months. Putting together the latest figures from the state-operated exchanges, the ones you see here in blue, it now appears that national enrollment is close to 540,000. Now, that's not including December enrollment numbers for the 36 states operating on healthcare.gov, the red ones that you see here. The Obama administration won't release December data until next month. But with the front-end process running well on the site, health officials are focused now on making sure that the back-end enrollment data transfers to insurers happens more smoothly. This weekend, they said the error rate on those transfer forms is now under 1%. On Friday, HHS Secretary Kathleen Sebelius said they are working closely to make sure those transfers are all correct.
We have a very dynamic system with insurers that they, again, feel that the so-called 834s, the transfer of that end information to insurance companies, is working extremely well right now. We are going to, again, doubly check and match because we want to make sure everybody is connected.
Still, even with a massive surge in enrollment this month, the numbers are still likely to run well below the original projections of 3.3 million enrolled by the end of the year. PwC Health Research Institute CC Connolly says the more important number now is the demographic mix. They need to make sure that they have a lot of young, healthy people enrolling. Bertha Coombs, Nightly Business Report.